Hafaday and good morning, everyone. Happy Friday. Thank you for joining us virtually. We have an overwhelming audience here in our Zoom room and a growing audience on our Facebook live stream to proclaim September 2021 as Recovery Month and September 2021 as Suicide Prevention Month. At this time, I'd like to recognize the presence of our Honorable Magahaga, Governor Lou Leon Guerrero, as well as the Honorable Joshua F. Tenorio Segundo Magalahan Guam, Lieutenant Governor of Guam. From the 36th Guam Legislature, I do see Senator Amanda Shelton. Thank you so much for joining us. And I also want to acknowledge our cabinet members joining us today. Director of the Guam Behavioral Health and Wellness Center, we have Therese Areola, as well as our Deputy Director, Ms. Carissa Pangilinan, as well as our Department of Youth Affairs Director, Lonnie Brennan. We have a long list of stakeholders. I'm just going to go ahead and list them by the organization they represent. We have Oasis Empowerment Center, we have Lighthouse Recovery Center, we have Sanctuary Incorporated and co-chair for Peace Council, we have Togi Corporation, we have Peace Council, we have more Peace Council members, we have Guam Focus on Life Fellows, we have the University of Guam Ipanangan Campus Suicide Prevention Program and the VAWPP program. We also have the Guam Community College Human Services Student Organization. We have West Care Pacific Islands, LifeWorks, Sanctuary Incorporated, Manelu, Guam National Guard, Rotaract, and Youth for Youth Live Guam, Gala Guam, and Inafa Malik. So Sizos Masi for joining us, everyone, today. I know everyone is busy, and also we have an overwhelming a number of viewers and participants in our Zoom room. I've actually reached my limit. We have over 100 people here and a growing audience on Facebook. So without further ado, I'd like to give the Zoom floor to Ms. Teresa Areola, Director for the Guam Behavioral Health and Wellness Center.
Thank you so much, Crystal, and thank you, Governor Lou Leon Guerrero, Lieutenant Governor Josh Tenorio, for, I know it's a busy day. A lot of things are happening in our community, and I appreciate the time that you have set aside for us. I want to recognize, first of all, September is a wonderful month. I personally love it personally for obvious maybe because I'm born in this month, but it's also a wonderful month that we celebrate Recovery Month as well as Suicide Prevention Month. And it's just right up our alley. So if you would just give me a moment to recognize my hardworking staff at Guam Behavioral Health, all of you on the Zoom room, all of you in Facebook Live, I cannot thank you enough for all that you do, especially during this pandemic, when our people need you the most. I want to especially recognize Ms. Athena Duenas, the Drug and Alcohol New Beginnings Manager. Thank you, Athena, for all that you do. It's a big lift that I know I'm constantly pushing and pushing, but with you and all the partners, recovery partners, thank you so much. Lighthouse Recovery, Oasis, Sanctuary, and Togi. I cannot thank you enough for all that you do. Thank you so much for your partnership. I want to recognize, of course, it's Suicide Prevention Month as well. And we've had some stories in the media about some sad loved ones and souls being lost to suicide. So how appropriate that we highlight the need to prevent suicide. I want to recognize Dr. Christiana Whitman. Thank you so much for leading the charge from Guam Focus and Life grant. All our prevention staff, my council members, thank you so much. Peace Council members that the governor has appointed, thank you for your hard work. All the support from the legislature. I see Senator Amanda Shelton, thank you so much for joining us. And all the partners of Guam Behavioral Health, thank you so much. It's such a, these are two big issues that are big, big things that our island is facing. And recovery and getting our people, I will leave the remarks about the wonderful thing that this Leon Guerrero Tomorrow administration is doing to our governor and lieutenant governor to mention. We're doing a lot of things when it comes to drug and alcohol addiction and getting the necessary resources and infrastructure in place for that. Suicide prevention, of course, is a top of our administration mind, and the support I get from our governor and lieutenant governor is humbling. I can't say anything else but humbling, because when I call, they answer. And it's just, there's just so much to say and thank, and not enough time. But I thank everyone who is here in the Zoom room, and I thank everyone who's listening and watching. Thank you for all that you do, and thank you for being part of the solution. My parting words is that Guam Behavioral Health is here for you. You are not alone, and please, if anything, if you need to talk to somebody, if you need to see somebody, that's what we're here for. We're here to serve you, the people of Guam. And the crisis number, again, cannot be stated more and more over and over. And I thank the Lieutenant Governor for making mention of that in last night's special address that he sent to the students and the people of Guam. But our crisis hotline is 24 hours a day, 7 days a week, here for you, whether it's suicide or struggling with your addiction or stress or anything that you're feeling that you need more help and somebody to talk to, especially during this pandemic. 647-8833. You're not alone. Guam Behavioral Health is here for you. It's clear that there's so many people on Guam that want to help just by the overwhelming number of people in the Zoom room and in Facebook. So, Siduas Maasi from Guam Behavioral Health for all that you do. And thank you, everyone. And kudos to all of you who are part of the solution. Thank you very much.
Thank you, Director Ariola. I also wanted to acknowledge Judge Ingalls is present on behalf of the Guam Family Recovery Program at the Superior Court of Guam. So Siduas Maasi for joining us, Your Honor.
Thank you.
And I now like to give the floor to Governor Leon Guerrero for her remarks.
Thank you very much, Crystal, and thank you, Therese, for your leadership also, and along with Carissa and all your supervisors, management staff, your frontline employees, your healthcare providers, your counselors, social workers. They all combine to provide the necessary prevention, awareness, and treatment for our people who are unfortunately addicted to substance abuse, and see their stress being so dire that their only coping mechanism is suicide, which is of course very unfortunate and tragic to family, friends, and the whole community. One of the things, benefits for proclaiming this month for Recovery Month and Suicide Prevention Month is it brings the community to a higher awareness of what is going on within our community and what is going on within our community to help address these issues everywhere from our schools to our courts, to our legislature, to our executive branch, to healthcare provider clinics, to nonprofit organizations. It just shows that it takes a whole community comprehensive approach to address these very tragic situations. And I think our attitude with drug addiction and substance abuse should be that it is a health issue and not so necessarily a criminal issue. And we need to approach it in that sense. And we need to make sure that we provide all the necessary resources so all of you who come to help that one individual or the whole community can have the means and tools to do so. Whether you focus in on an individual person or you focus in on a group, Our responsibility as public officials and leaders is to provide the resources, the environment, the skills, the talent, and everything that we possibly could do to help individuals go through some very, very critical and stressful situations. I also believe that mental health is just as important as medical health. And some people even say mental health is more of the compelling interest than the medical health. You talk to the medical people and they'll say medical health is more compelling than mental health, but I don't see it that way. I see it as co-equal important um, uh, illnesses, and that treatment has to be just as equal and equitable in the whole healthcare industry and the whole healthcare scheme of looking at that individual. So I just want to say thank you. And thank you so much for all that you do during less stressful situations and all that you do during stressful situations. And our community is going to some major stress right now. And I think we should rally up more our energy, our efforts, our strength, and our passion and compassion to work together as a community to help us get through this. And I just want to say, without all of you who are the stakeholders and who are the ones that really go out there and meet these people in the front line, I say thank you and know that our administration totally supports your efforts, your vision, your mission, as they are also aligned with ours. Again, thank you, and please be safe out there and know that you are appreciated very much within our community and our administration. Sizus Masi.
Thank you, Governor. I'd now like to give the floor to Lieutenant Governor Josh Tenorio.
Thank you, Crystal. I also want to join the governor and thank everybody for their collective efforts to try and improve and advance our system of responding to the substance abuse crisis that we've been seeing over the last few decades. But I do see a light at the end of the tunnel, and the governor and I, with JBWIC, have plans and are moving forward on plans to expand facilities and programming. I'm hopeful that by this time next year, we're going to have additional inpatient capacity for men, in particular, at this government facility we're going to recover in Talofofo. That's going to help with this effort. We're also making plans to construct a drug and alcohol building so that we have more treatment spaces and we have more facilities that are going to be available for all of our peer support programs. I do want to recognize that I think one of the most effective areas is peer support. It's the most effective thing. The groups that are conducted in the nonprofit world by the judiciary, these are some of the most effective and long-lasting, life-changing programs that are evidence-based that really can get people on a path to recovery. And so for the folks struggling with recovery, it is, of course, a lifelong, I guess, journey. And sometimes it's going to be very easy, and sometimes you may have some difficulties, and sometimes you may make mistakes. And everybody does make mistakes, but we just want you to make sure that you don't get hopeless, and it always can get better. So utilize the resources, and the best resource are all the peers that you have. I noticed that streaming in is the RSAT class from Department of Corrections. I also want to just take this time to commend the inmates at DOC that are on the cusp of being released. And part of this encouragement and support is making sure that we help you get into your path and advance in your path to recovery, and so that we can welcome you back into the community where your family and friends are waiting for you. So there's a lot of good stuff that I feel is going to happen. And it's going to happen because of all the change agents and folks from the government, from the nonprofit, and the leadership that you see here today. And with regards to suicide, I just wanted, of course, last night I had an opportunity to reach out and push out information to drive people to call the crisis hotline. Crisis hotline have some folks that answer it, but I can guarantee you that volunteers and help are always needed. And so I definitely would like to help Guam Behavioral Health find pathways for everybody in the peer groups to consider becoming volunteers in the crisis hotline, and expanding the number of people that we can go and intervene and save lives. This is a very stressful time, but I want you to assure you that the governor and I, although sometimes the decisions are not so popular, the decisions that we're making are in the best interest of the entire island, and really is in the best interest of trying to get back to normal so we can try and expand the number of events and the number of things that we know we need to do to advance the efforts against substance abuse and against suicide. So thank you, everybody. And to everybody here that is on their path to recovery, congratulations. I'm really inspired by what you're doing, and you don't know how much you are impacting the lives of others. Many times you might not know that they're watching you, and I don't mean to say this to be a pressure on you. I think you should take it as you and your success can encourage others to follow your path. So congratulations.
Thank you, LT. And now for the reading of the Recovery Month proclamation to be done by Ms. Val Rages from the Lighthouse Recovery Center.
Half a day, everyone. Half a day, Governor, Lieutenant Governor, and my favorite people in recovery. Viva recovery! Proclamation 2021-58, a proclamation of the Governor proclaiming September 21 as Recovery Month. Whereas recovery from mental and substance use disorders, including co-occurring disorders, is an essential part of health and one's overall wellness. And whereas treatment and recovery services for mental and substance use disorders and co-occurring disorders is effective, and people can and do recover in our area and around the nation. And whereas addressing and overcoming mental health and substance use disorders and co-occurring disorders is essential to achieving a healthy lifestyle, both physically and emotionally. And whereas we must encourage relatives, friends of people and with mental and substance use disorders and co-occurring disorders to implement preventative measures, recognizing the signs of a problem and encouraging those in need to help to seek appropriate treatment and recovery support services. And whereas an estimated 25,000 people in Guam are affected by these conditions, and whereas to help people with lived experience achieve and sustain recovery, U.S. Department of Health and Human Services, Substance Abuse and Mental Health Services Administration, SAMHSA, Guam Behavioral Health and Wellness Center, the Judiciary of Guam, the Department of Corrections, Sanctuary Incorporated, Oasis Empowerment Center, the Salvation Army Lighthouse Recovery Center, and TOGI invite all residents of Guam to participate in National Recovery Month.
Now, therefore, I, Lourdes A. Leon Guerrero, Magahagan Guahan, Governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam, as amended, do hereby proclaim September 2021 as Recovery Month and call upon the people of Guam to observe this month. with appropriate programs, activities, and ceremonies to support this year's Recovery Month theme. Join the Voices for Recovery. Together we are stronger, and to celebrate the 30th anniversary of the Recovery Month observance.
In witness whereof, I, Joshua F. Tenorio, Segundo Magetlahing Guahan, Lieutenant Governor of Guam, hereby, together with the Magahaga, cause the Great Seal of Guam to be affixed in the capital city of Hagatna on this 3rd day of September in the year of our Lord, Anno Domini 2021, and Biba Recovery.
And congratulations to all the recoverers.
Congratulations. Moving on to the reading of the Suicide Prevention Month proclamation to be done by Mr. Victor Camacho, co-chair for the Peace Council and executive director for Sanctuary Incorporated.
Day, good morning. Proclamation 2021-59, a proclamation of the governor proclaiming September 2021 as Suicide Prevention Month. Whereas behavioral health is essential to overall health, and as our community continues to battle COVID-19, it is vital that we not only take care of our physical fitness, but also prioritize our mental health and emotional well-being. And whereas although suicide is a challenging subject to talk about due to the shame and stigma associated with it, we must make it a point to have courageous conversations and understand that suicide is everyone's business. We want to encourage our community members to please stay with us. And whereas in 2020, Guam lost 40 lives by suicide, and Guam's suicide rate continues to be significantly higher than the US mainland. And whereas Guam's suicide risks are seen highest among youth and young adults, almost half of those who died by suicide in the last 10 years occurred in individuals 30 years and younger. And whereas with help, there is hope, and Guam has seen a growing number of trained natural supports and community gatekeepers who have completed evidence-based trainings on suicide prevention, intervention, and postvention. And whereas over 300 individuals were trained in suicide prevention, including LifeWork Start, Safe Talk, Assist, and Assessing and Managing Suicide Risk, AMSR, in the last year. And whereas Guam Behavioral Health and Wellness Center and its partner agencies, namely the University of Guam and its Ipanangun Campus Suicide Prevention Center, the Guam Community College, the Guam Department of Education, the Guam Army National Guard, and multiple non-government organizations, including Sanctuary Incorporated, Manyetlu, LifeWorks Guam, Breaking Wave Theater Company, and Gala, among others, are leading efforts to raise awareness on suicide and help those at risk. And whereas the Guam Behavioral Health and Wellness Center's crisis hotline has been in operation for 24 hours a day, 7 days a week, and on January 11, 2021 was recognized as the National Suicide Prevention Lifeline Center, and all calls to the lifeline from the 671 area code are routed to local resources, allowing for immediate attention and response. And whereas September is National Suicide Prevention Month, a time to draw attention to the issue and advocate for prevention by learning more about suicide, its warning signs, and by supporting someone who might be at risk for suicide by reaching out and asking for help.
Now, therefore, I, Lourdes A. Leon Guerrero, Megahagan Guahan, Governor of Guam, by virtue of the authority vested in me by the Organic Act as amended, do hereby proclaim September 2021 as Suicide Prevention Month.
In witness whereof, I, Joshua F. Tenorio, Segundo Magetlahing Guahan, Lieutenant Governor of Guam, hereby together with our Magahaga, cause the Great Seal of Guam to be affixed in the capital city of Hagatna on this 3rd day of September in the year of our Lord, Anno Domini 2021.
Congratulations.
Congratulations. I do see some members of our media present with us in our Zoom room. If you have any questions related to either of these proclamation signings, you may unmute yourself and ask them now.
Hi, Crystal. Good morning, Governor. Good morning, Lieutenant Governor. This is Oya from the Guam Daily Post. Sorry, can you hear me?
Yes, Oya, go ahead.
Okay, thank you. I wanted to ask Ms. Teresa Ariola, or the governor can answer this, but what are we seeing in terms of calls to the behavioral hotline that the Lieutenant Governor was talking about earlier with respect to sort of the continued pandemic? Yeah, that was basically it.
I can answer that, Governor. So because of course, the high volume of positives out there in our community regarding COVID, and as well as the recent announcement of unfortunate deaths because of COVID, it is a natural and a trend that our crisis hotline numbers trend up. So for the month of, we've always been averaging around 600, 700 for the last year. I can tell you that in the month of August, we are trending upwards to 800 plus. And so that is not a surprise to us here at Guam Behavioral Health and the crisis hotline team, because it always takes up an uptake during when there is a high number of positives and an announcement of deaths. And so, of course, I'm going to take this opportunity to encourage everyone to protect yourself in another layer and get vaccinated. So our team has been, we have a 24-hour team, and I'm grateful for all the federal funding that has come down our way, because we are able to get not only SAMHSA funding, but FEMA funding to manage the crisis hotline. Most of these calls are, of course, anxiety and depression, all leaning towards the uncertainty and the concern they have with regards to COVID. And so we're addressing that. And some calls end up in one call and just needing somebody to talk to. But the wonderful thing about the crisis hotline is, if necessary, and they need more intensive services, then it's a conduit to intake and getting them an appointment here at Guam Behavioral Health. So thank you, Oya, for that.
Thank you, ma'am. And I was wondering, how many folks do you have manning the hotline? And I know Lieutenant Governor was talking about increasing and calling for volunteers, or creating a pathway for more volunteers. How many people at this point, as you're looking at an increase in calls, do you guys have, and how many do you need?
Well, at this point, we are able to maintain it because we got federal grants and we've received we were able to hire more staff. In the past, the crisis hotline was not a dedicated staff. When in 2019, we decided that it needed to be a dedicated staff. It was no longer possible, or 2020, I'm sorry, when the pandemic hit, it was no longer possible to have our nurses station answer the crisis hotline. So dedicated staff needed to be hired, which we do have. We've hired a number of folks to man the crisis hotline through different programs, such as Mangaigiham, which in Chamorro, that's in Chamorro, which means we are here for you, as well as the COVID emergency grant. And so we are well stocked when it comes to trained folks, but we also have a standby of volunteers that are trained, that can come in if, for example, somebody's out sick, and with the spread of COVID right now, we're always having to have a contingency plan. And so as the Lieutenant Governor asked for more volunteers, they would need to be trained. And so there's always, it's always a good thing to have a backup group of folks. But today we have a good number of folks that are trained and a good number of volunteers who are on standby who are already trained. But it's never, you know, it's never a waste if more and more people get trained, because not only can you use your skills in the hotline, but use your skills in the community to talk people through into getting more services.
Thank you, ma'am. Finally, just one last question. What are the age groups of the people who are calling?
I don't have that specific number age group, but most of them are adults, I can say.
Thank you,
But I
ma'am.
don't have the specific breakdown right now. Thank you, Oya.
Yes, thank you, Oya. I also see PDN's Jackson Stevens. Do you have any questions for our stakeholders here?
Not right now, thank you.
Thank you, Jackson. Any other members of our media present with any questions? Okay, thank you so much, everyone, for joining us. This will end today's Zoom proclamation signing, but I encourage you to please stay online so we can take a group photo. Again, congratulations and please be safe.
Chris,